Hey all, thanks again for being willing to be able to partake in running a station for the upcoming Kinvent in service. I'll make this pretty quick and I'll also allow you to run your station at your discretion. But a couple of points that I did want to convey. The first being is that I think our goals for this in service, as we introduce this to the team, is to make it as easy as possible. Make it look simple, make it feel simple. Obviously, with this, make it fun, express your enthusiasm for using the tool, the assessment, as well as the interventions for your station and for whatever device you're utilizing. I'd also make it practical to clinical practice. So think about the most common, or the most common trainings and or assessments that you would think would capture the interests of most of our clinicians based off the caseload that we're seeing. Based off the results of the assessments, I also am of the firm belief that a clinician should be able to do each of the following. They should be able to repeat it and repeat the assessment, make it reliable. They should be able to benchmark their patient based off the patient's results, i.e., there's going to be some form of normative data based off their patient. They need to be able to monitor the progress over time, meaning they'll need to understand and you'll need to convey what is the minimal detectable change or minimal clinical important difference. You could also consider this to be the standard error of measure, right? So if you're testing external rotation or hip abduction, or you're doing a squat analysis, what is a meaningful change from time point 1 to time point 2? And then also be able to prescribe. Try and help the audience and our teammates to determine, based off the results, what interventions or how does that guide your intervention and your exercise prescription. It would be my recommendation. So with those 4 points in mind, I've created, for each of the different stations, I've just created some template slides. Feel free to change them, make them yours. The way that I envision this going is that we'll each have a station somewhere in the clinic. We'll each have a computer screen, like one of the workstations where we can just pull up our slides, or if you want to have a laptop, or if you want to have your iPad. Again, I think that I want to give you guys the autonomy to be able to run your station the way that you foresee it. But the way that I envision running mine is that I'm going to have a workstation pulled up. I'm going to have the slides there. And then I'm also going to have a tripod or my iPad right there to run the Kinvent app. And then I will probably ask for volunteers to go through the different assessments as I talk through them. So the different stations. So Olivia's going to take the K push. Albert, you're going to take the K plates. Kobe, you're going to take the K pull. We don't have anyone for the K bubble. I'm going to try and recruit my student. And then I will try and combine the K move and the K deltas into a single station. So the example of some of the slides that I've put together, again, feel free to make it your own and do whatever you will. You don't even need to use slides if you don't want to, but I will say just be prepared for the different questions that you otherwise may get. And yeah, make it informative, make it fun, make it enthusiastic. But these are the ways that I'm going to run my station. So I'll be like, okay, what's the K move? Sampling rate, smallest increment of measure, plus or minus 2 degrees. You can find all this in the manual or online. Standard error measure based off the different axes. The acceleration, test, retest reliability is going to be dependent on the movement, obviously, and then the validity as well. But it's within plus or minus 2 degrees. I do the same with the K deltas as far as the sampling rate, how many times it's taking a sample per second, the smallest increment of measurement error, the coefficient of variance that has been described, the test retest reliability, and so on. I did pirate a couple of the slides from VN with just conveying the different coefficient of variance based off the test. And I break down the different movements that I'm going to be doing, which is going to be, I think I'm going to do the counter movement jump as well as the squat jump. The way I'm making it clinically applicable and to spark interest is posing a clinical question. Does my patient require more strength training, or are they ready for plyometrics, or do they have sufficient plyometric like reactive force production? And I'll be using the eccentric utilization ratio as as an example of that, as I'll have a volunteer do a counter movement jump and then a squat jump, and we'll calculate the EUR. And see where they're at. I also provide the normative value so that they can benchmark themselves, and then this is the way I would help determine prescription and or influence of the intervention. All right, thanks again. Hope this helps maybe give you some structure as you conceptualize and kind of prepare for Wednesday. All right, thanks again.